Hello everybody, welcome back to another episode of Diabetes College. Let's Diabetes It. So today we're going to start talking about type 1 diabetes management. Disclaimer again, I'm not here representing any organization. I'm here for Diabetes College. Let's Diabetes It. An interaction session only, and you can always go to your doctor if you have any concerns regarding diabetes. Okay, so when we talk about type 1 diabetes, type 1 is caused by autoimmune reaction where the body's defense system attacks the cells that produce insulin. And so as a result, the body produces very little or no insulin at all. The exact cause of this are yet unknown. There's still ongoing research about what type 1 is all about. But they are linked to a combination of genetic and environmental conditions, which we are not going to exactly dwell on in this particular episode. So what are the signs and symptoms of type 1 diabetes? According to IDF 2017, the following, I've listed this previously anyways, but I'm going to repeat it again. There is abnormal thirst and dry mouth, there's sudden weight loss, frequent going to pee, which we call frequent urination, lack of energy, tiredness, there's constant hunger, there's blurred vision, and there's bedwetting. So those are the classical signs and symptoms of type 1. But if nothing happens, it will get into what we call the medical emergency, which we'll talk about in upcoming episodes. Then, talking about management of type 1 diabetes, there are various approaches, but the hallmark of management for type 1 diabetes is insulin administration, because the body is no longer making insulin. So you can manage type 1 diabetes by taking insulin as recommended by your doctor or any other acceptable medication that your doctor, who's a specialist in diabetes, will be able to prescribe for you. Monitoring your blood sugar levels regularly with your home glucose monitoring is very essential. We also recommend eating healthy meals and snacks. We recommend you enjoying regular physical activity. You aim at a healthy body weight and you try as much as possible to manage stress effectively. So all these are combination approach to managing your type 1 diabetes. There are various approaches to giving insulin injection. The ones you're going to be doing at home, it could be by vials, which you use syringe and needle. You could use pens, and you could also do insulin pump. Depending on your own approach. According to Fit Canada, they recommend that you use between 4 to 6 millimeters of needle size for every skin thickness, for every color, for every race. This is based on their calculation that that size of pen can get to where it should be without you pinching your skin. If, however, the needle is a lot longer, like the 8 millimeters, the 12 millimeters, then you will need to pinch your skin. Well, these are the administrative various. There are so many needles for insulin injection. Whichever works for you is recommended. Whichever approach you are using, the sites of injection are the same. So looking at the diagram here, you could either do that around your abdominal region. You can divide your abdominal region into 4, do the upper quadrants, and then go down to the lower quadrants. Or you could go on the side of your thighs. It's always very good to rotate. And then you could do at the back of your arms. The abdominal, back of the arms, and the side of the thighs are the best sites for your injection, for insulin injection. And there are other sites, what you call the love handle, and at the top of your at the bum area. But those areas are if you are out of sight. The best convenient area typically is the abdomen. But one thing I do mention to people is, yes, it's quite convenient to use your abdomen. That's your stomach area. But it's highly abused because people can easily access that. Stay away from the belly button if you're using it. But just make sure you rotate around your stomach area, and then make sure you go down to the side of your thighs and do the back of your arm. Someone can help you do the back of your arm because of the awkward way of approaching it. Okay, so these are for us just the first approach to insulin injection, not just for type 1 but even for type 2s or to gestational. If you are using insulin, the approach is one and the same thing. Okay, so for that, till now, I'll say look forward to the next episode. We're going to demonstrate how to give insulin injection, and we'll still continue to talk more on management of type 1 diabetes.